it takes me a minute to get this camera situated. Couple things. We are going to talk about advanced care planning. I actually recorded this during my class, but kind of butchered the lecture during class. So anyways, um, we will go ahead and talk about this. So you guys can follow along on that website that I gave you. That's what I'm going over. I think that they talk about advanced care planning. I think they do a really good job of explaining what everything is, and so this will be important for you guys. Um, Advanced care, we talked about a little bit the other day, but it's just what happens to you or what you want to be done in the case that you cannot do for yourself, cannot make decisions for yourself, um, you know. So now there would be a person usually at a hospital that specifically could help you in deciding exactly what you want. So it says, look here, advanced care planning answers the following two questions. If something were to happen to you, like a big stroke or a heart attack or a terrible car accident, and you could not make your own decisions, who would make those for you? So that's something you can specify on here. And then it says, if it were discovered that you were terminally ill and no matter what was done, you were going to die, would that person that you chose know what your wishes would be? Do they know what you would want to be done? And what if you were in a permanent vegetative state and could be kept alive like that for years? Is that something you would want? So they put you on life support. Do you want to stay on life support, or do you want them to take you off? So those are things that are really important. One, as patients, as us for healthcare workers, we need to have an idea of is this patient, what do they really want? So for example, up at the nursing home that our students have been doing clinicals at, that's the first thing on their chart that you see is if they are a DNR, a do not resuscitate, or if they, kind of what the specifics are as far as what they do and don't want done. Where am I? It is something that's important that you share with the people that are around you. So some of you guys, you're old enough to think about some of these things. Maybe you want your organs donated. Maybe you don't want them, and there's, if you don't want them donated, then that's up to you. You have the right to make that decision, but that's something you need to share with your family. Hey, if something were to happen to me, I do, or I do want my organs donated, or I don't. Now, for me, I've got it listed on and some of you guys may have it listed too on your license. If you have a driver's license, it'll say donor on there if that's something that you've opted to do. And it is something for me because I feel like once I'm dead, I'm not going to need them. So, and you hear a lot of people that get concerned about donating their organs because they think that that they're going to come along and make them die quicker so that they can have their organs. But truth be told, like, if they're killing you so that someone else stays alive, like, the doctors don't really care who it is, they do, but at the same time, it's like, what is one person's life to save another in that kind of situation? So, I think that's more of just a panicky kind of thing that people think and just causes fear. I'm not saying it would never happen because there may be some crooked people out there who it would, but it says medical care providers and facilities are obligated to honor your treatment decisions. Another person that needs to be informed of if you ever take out any of these advanced directives or advanced care measures is your physician. They need to have an idea of what you expect. Now, I'm not telling you guys that at your age you need to go make a paper that has your advanced directives on it. That's something, whoever is your next of kin is going to make those decisions for you anyway. And that's something you might want to leave up to them in the situation. But if you have an idea, if you know that if you're going to have to be on life support forever and you're never going to, know anything or anything like that, and you would rather not be on life support, that's still something that you should talk to your parents about. Because if the time ever comes, you don't know what your parents would be feeling, or whoever takes care of you. And that may be something that they struggle and they feel guilty about, so they don't take you off life support. So, those are things that I think it's important for you guys to talk to your parents about, even now. Um, anyway, so, okay, we'll keep going. Okay, it says advanced care planning is the process of helping people to understand the importance of preparing for future medical care. As it means that you're sharing your story. What's going on with you that makes you want to do this? You're sharing how you feel about your future. It says advanced care planning is the process by which an individual considers his or her personal values about the dying process. So what are your values? And we're going to talk about death and dying in a couple units, and you'll get to think through some of this a little bit more. It says discuss those values with family or others close to them and healthcare providers, and then advanced care planning, in that you complete the documents that you need, and we'll talk about the specific ones. It says advanced care planning involves two basic parts. First is you need to decide what you want. So you need to think about different situations. So if you're explaining this to someone, this is a really good way to explain how this works. It says the second part is to communicate with people. So you're telling people what you would want. Okay, let's look at these different ones. Advanced directives, it says. These are documents used to help a person express his or her wishes and values about medical care in case that they cannot do that or make that decision at some future time. So, it says in Texas there's 3 commonly used documents to record this information. Okay, they're not required, but they are recognized, and these take precedence over whatever situation is going on. Unless there's a court-ordered something or some kind of, violence or criminal or something like that going on. It says you may wish to use other documentation that's more detailed, but these are a good way to start. And you can go to the website you can get to them from here, but you can go to the Texas State Department of Health website. You can find these very easily online, and you just print out the forms and you use them as long as a witness or someone signs. It is really good, though, to make sure that whoever's taking these out talks to their physician, so they make sure that they understand all the procedures that they're talking about. Okay, your 3 are your directive, the medical power of attorney, and an out-of-hospital DNR. And we'll talk about those 3. Okay, advanced directives do not require a lawyer or a notary public. Okay, your directive, sometimes you'll hear that referred to as a living will, and you'll hear me refer to them typically as a living will. It's kind of their more common name. But a living will is not the same as like your will to your estate. It's completely different. Okay, your will to your estate, or that's like your items, your assets, the things that you own, your money. Living will is when you're still alive, what you do and don't want to be done to keep you alive. Anyways, it says these are free. So these documents are free. You can always print them off and do them. They do require a witness. It says, and in the case of the out-of-hospital DNR, a physician's signature. So that's the only one that a physician actually has to sign. And then it says that they take effect only when you are unable to express your wishes for yourself. So only when you have been deemed unable to make a good, conscious decision will these actually go into effect. And they are reversible, so you can always change them, you can always get rid of them. Okay, so let's look at this first one, a directive to physicians and family or surrogates, aka a living will. Okay, so this allows a person to indicate choices about treatment in the event of a terminal or irreversible disease or condition. So terminal means death is imminent. I think somewhere else I read in the next 6 months at least is considered terminal. Irreversible is more of like just something that there's no cure for, there's not going to be any treatment. More of that irreversible disease or condition is more like if you're in a car accident and you don't have any brain function. Okay, that's irreversible condition, if that makes sense. It would also be terminal, but okay, this document records for your physicians, your family, and anybody else who would need to see it, that what your wishes are if you can't speak for yourself. So it says it specifically allows you to choose whether you would like life-sustaining treatments in two situations. Again, terminal condition or irreversible. And you guys can look those up. If you click on that, you can go look at the difference in those. Okay, it says life-sustaining treatment is any treatment, procedure, or medicine that doctors believe is maintaining the patient's life. Without it, doctors believe the patient will die. So that's life-sustaining treatment, something that's making somebody stay alive. It says examples include life support equipment such as a ventilator or breathing machine, kidney dialysis, medications, pacemakers, feeding tubes, IV, or nutrition through an IV, and blood transfusions. Okay, so if you say you want no life-sustaining treatment at all, you know, these are some things that it wouldn't include. So a lot of people want to be more specific. They wouldn't want to say, I don't want any. They'll be specific for what they do and don't want. Now, sometimes medical care, whether it's a treatment, medication, or procedure, such as an operation, is provided to make the patient more comfortable or to prevent or manage pain. So that's not life-sustaining, that's palliative care is what that's actually called, palliative, and that's just to make someone more comfortable. Hospice, which we talked about last year at least, is providing a gentle, natural death by controlling pain and other physical symptoms and providing support, emotional and spiritual, to dying persons and their families. Under their philosophy, it says death is neither hastened nor postponed. So they're not trying to bring it quickly. They're not trying to drag it out forever either. Terminal condition, incurable disease, illness, or injury that doctors expect will cause death within 6 months. An irreversible condition is a disease, illness, or injury that cannot be cured, even though it might be treated. The difference is they're never going to get rid of it. They can give them something for the symptoms, but they're never going to actually be cured of it. It says many irreversible conditions will reach an advanced stage when they will also be considered terminal. Okay, it says it's important to remember that it may no longer be possible to make a person well or return the person to his or previous state of health or independence. In those situations, treatments or machines that support organ systems may also cause suffering and prolong the dying process. I had a student ask, why would you, I can't think of it. Why would you want to go ahead and die? Or why would she said it sounds like hospice is just trying to push them to death, but that's not really the case. Some people have been suffering for so long, or they're in such a state that their quality of life, because of their irreversible condition or because of their terminal illness or whatever it is that's going on, it has so decreased how just the quality of their life, so how they're living, that they would rather just let go and be done, And that's okay. Now, it's illegal to help someone in their life. That's called euthanasia. And we talked about that last year a little bit. But, anyway, so that's kind of something to think about. It says, in your directive, you have the opportunity to explain your wishes and include additional requests. So, particular treatments you do. So maybe you don't want to be on a ventilator, but you would want a feeding tube. Or maybe you would want medications, but you don't want the ventilator or so forth. Or you wouldn't mind blood transfusions. Those are some things that you need to specify. Or I think it's helpful if we specify. It says, an appointed decision maker cannot overturn your directive. So if in the case that you go into, you go unconscious and can't make decisions, your directive that you've written out stays. Regardless of the decision that your family makes for you, that comes first. The directive does, because you made that yourself. It says you have the opportunity to appoint a spokesperson to make health decisions for you. And that can also be done another way, but there's a place on this directive that you can actually write that out. It says I'm sorry, I lost my spot. Many people worry that if they complete an advanced directive, they will not receive the treatment that they want. So it's important to remember that they only take effect in the event that you can no longer make decisions for yourself. And you have to be in a terminal or irreversible condition. You can also change them at any time. Okay, let's look at the second one. It's called a medical power of attorney. Sometimes, previously it says durable power of attorney for healthcare. So you'll still hear them referred to as both, but medical power of attorney is probably what you hear now. What this means is that a person can name a specific individual to make their healthcare decisions for them in the case that they can't make them for themselves. So whereas a directive or a living will, I decide what I do and don't want. In a medical power of attorney, I assign a person to make that decision. Now, in real life, they're going to have the next of kin make those decisions. That's who's going to make them. But if you have, let's say instead of your mom, because your mom doesn't live with you, you would rather, I shouldn't say that. Whoever's your guardian, like your next of kin, is going to be the one. So, if your grandmother is your guardian, that would be the person to make decisions or whatever. But let's say you want your second cousin to make your decisions for you instead. That's a reason you would need to complete a medical power of attorney. If you want someone besides your next of kin to do that. Says Texas has two powers, financial and medical, and they don't cross over. One cannot do both, so they're separate. So the person who's the medical power of attorney can't make any decisions over that person's money, welfare, so forth. Okay. Let's see. It says two important points about the person that appointed to be your medical power of attorney. They need to know what you would want. They need to know your wishes and your desires and what you would or wouldn't want done. And second, they need to be willing to follow that. They have to make decisions in accordance with what you would want. And you want to make sure that you have somebody who can handle that. It's a difficult thing to make decisions when somebody's lying in bed and you're trying to decide whether you should let them die or not. That's not an easy thing, not at all. And so you need to be clear on what you want, or you need to tell people to make sure that they're clear. And if you guys will, I do want you, as soon as I get done, see where it says the printable, says on the website you can get the printable directive and the printable medical power of attorney. I want you guys to click on those afterwards and just read over them and see what it says and how they're formatted. Okay, last one is out of hospital DNR. And you guys may see this, if any of you guys are doing home health or if you're going to a nursing home for clinicals, you may see some of these. But out of hospital DNR says it's used most commonly when a person has a life-threatening or terminal illness and does not want a 911 emergency resuscitation in the event that he or she dies. So they don't want CPR done. They don't want any life-sustaining treatments at that point. Do not resuscitate. And they have to, if you have an out of hospital, it has to be posted somewhere where it can easily be seen. So I used to have a home health patient, and as soon as you walked into her house, right beside the telephone, she had it in a frame. It was her out of hospital DNR. And they knew she was very, very old, and she was ready to go, and she had severe dementia, so she didn't always know who she was or who anyone else was, and she was ready. It says this does not apply in the inpatient setting, but does apply at home, in the nursing home, grocery store, hospital emergency room, clinic. So a copy should be, like, the doctor needs to have a copy. A copy of it needs to be put into a wallet or something that somebody carries with them. It says, unlike the other two, this directive may be executed by a surrogate for an incompetent patient. So medical power of attorney and a directive, only the person themselves can actually make make those documents. A DNR, a family member, like the next of kin, the surrogate, can actually make a DNR for them. If they get to the point where their quality of life is so low, they feel like they could, they might want a DNR, that's something a family member can do. The only difference is this, it has to be signed by a physician, and the physician has to state that they have a terminal or irreversible condition on there. And whenever you look at that form, I want you to look at that too. There's different blocks. There's one block for a minor, and there's different situations. I want you guys to look at those, and you might talk about those as a class. Okay, last little section. It says 2 witnesses are required to sign all of your Texas Advanced Directive documents. One of these witnesses, so 2 people, random people, have to sign it and say that they saw you make this decision. Can't be someone related. It says one of these witnesses must be someone who is not. One, someone who's related to you. A person that has a claim to your estate. Person appointed to be your spokesperson, so the person who you've made your medical power of attorney. Your attending physician or one of his employees, or any other healthcare provider that's providing some kind of care. So that's these. I do, like I said, I want you guys to look at those forms, just discuss them amongst yourselves. And if you have any questions, you can email me or ask your teacher. They probably have an idea about some of this stuff anyway. Okay.